Go ahead and start with your questions, Debbie.
All right. Okay. Um, so my first question is, how did you become involved with treating mold and mycotoxin illness?
Well, as many people in the Lyme community know, I started treating Lyme disease in 2003 when I figured out what was killing my only child. And then I was sharing some patients with James Schaller, who was near me at the time in Westchester, and he was helping with some of the psychiatric issues in some of my patients. And in 2004, I discovered that the house I was in was, flowering and mold all over the place. I found mold on my books and, all over the basement and all over everything. And he said, "Oh dear, we have to deal with that." So he had his staff photocopy and send me a copy of Mold Warriors before it was even published.
Hmm.
So I started learning about mold disease very early on and followed all of the developments over the years. And with my sort of special brand of the way I treat, I developed my own treatment protocols and whatnot. But I've been treating mold patients, since 2004.
Wow. So as I said, most of us have only heard about really treating mold disease or what's happening in the last few years. Do you think it's increasing prevalence or we're just more aware of this?
I think people are more aware of it. Ever since the building practices changed in the 70s after the first oil embargo, um, they started hermetically sealing buildings. And yes, the building materials have gotten worse and worse and more prone to mold, but it really hasn't, it's been decades that it's been happening. So I think the community is just, becoming to know about it more and more. I started talking about mold in all of my lectures, ever since 2004, just about. And it really wasn't until Neil Nathan started talking about it in 2008 that people even started listening. And then, it just took a whole lot of time for people to really understand and get their head around how important a problem it is. Something like 30% of public buildings in the United States have some sort of indoor toxic problem, and many homes do as well.
That's a lot. What about other infections that go with mold and water damaged buildings? Are there other infections you're concerned about?
Yeah, there are a lot of things that you're concerned about in water damaged buildings. It's not just the actual mold growth, but it's, all the toxins from the mold, it's all the particulates from the mold, and there are bacteria that grow in water damaged buildings, gram negative and gram positive. You've got actinobacters, you've got mycobacteria, you've got even Pseudomonas, you've got Nosocardia, you've got Streptomyces. And these bacteria, have endotoxins, which are toxic, as well as the lipopolysaccharide fragments of their cell walls are also immunogenic. And so, problem is that people often don't look for the bacteria in water damaged buildings, and the endotoxins and the mycotoxins together act synergistically to elicit incredible cytokine storms in people.
Wow. Okay. Yeah, I think that's good to know because I just think of the mycotoxins and I've heard about some of the infections, but not really knowing how to identify them or treat them, or if you need to kind of look at some things differently. My question is, what about symptoms? What symptoms do you see, and how do you really distinguish those between, some of the other non-specific symptoms in patients with Lyme and things like that?
Well, the consequences of chronic exposure to these biological toxins. So all of these biological toxins, I sort of lump together and call it biotoxin illness and some biotoxin exposure. You get a chronic inflammatory state, which is just horrible. It's just, and it creates an overwhelming fatigue. You get all kinds of immune system upregulation with multiple chemical sensitivities, with histamine reactions, with allergic upregulation. Every single organ system is affected. The nervous system, the lungs, the gut, the endothelium, the musculoskeletal system, the kidneys, the eyes, you name it. The hormonal system gets all dysregulated. There are both direct and indirect toxic effects of these, toxins on the body. So, the symptoms are really protean, and it's all of the chronic symptoms that people give us. But the things that I associate more with specifically mold illness versus something like a chronic infectious disease like Lyme or a chronic viral disease is Mold patients are really profoundly fatigued. They have absolutely no anaerobic tolerance at all. They are, drinking all the time. They're sitting in your office drinking water all the time, and they get incredibly thirsty at night. They have a really dramatic loss of short-term memory. They're the ones that'll walk into a room and forget what they walked in the room for, or they'll could be confused and they put the milk in the cupboard and the cereal in the refrigerator, or they'll be, driving home from the post office on a road they've driven 1,000 times and they all of a sudden won't recognize where it is. They get electric shocks easily from touching all kinds of things. They gain weight often, not all of them, but some of them will gain weight despite just drinking water because of the leptin dominance. They get short of breath going up a flight of stairs, but they can walk on a flat without getting short of breath. And then they'll often complain of a racing heart at bedtime when they lay down. Some people with mold illness can't sleep at all. Some people with mold illness will sleep 16 hours a day. These people are also incredibly sensitive to electromagnetic radiation, and they have multiple food sensitivities. So those are the key ones. There are many, many other symptoms, but those are a lot of the key ones that I think of when I think of, is this a mold patient or not?
Okay. What about the mast cell activation? Because people were asking already about how does that, how do you determine that that's going on if you've also got the mycotoxin, the biotoxin illness? Is that something you get separately?
I think a lot of us have been treating, mast cell problems, long before it was even called that, because we were always treating some degree of inflammation in the immune system, and it's just another branch of the immune system that we have to deal with, and it's incredibly common in mold patients. The mold toxins will go through mucosal membranes, they go through the skin, you breathe them in, you swallow them down, and so many branches of the immune system are alerted because they enter the body through all portals. And so a lot of the dermatographia and some of the sort of, rashes that come and go, these streak rashes that all of a sudden are there and then they're gone in 5 minutes, the sort of mast cell activation type things that people have on the skin as well as after they eat. This is almost always associated with mold toxin intoxication.
Okay. So if a person is concerned about their home and they have symptoms, so people always assume, how do you test your house? Like, how do you find out what's the best way to test your home or your workplace in terms of mold?
Well, it's harder to do the workplace, but there's a whole series of questions that I go through when I take a history from patients. And ask them if there's any history of prior or current mold growth that they see in the house or they smell in the house. How old is the house? What building materials were used? Is it guttered properly? Does water lay around the foundation after rains? Is there any moss or mold growing on the outside walls of the house? Is there any rotting of exterior woodwork around windows? Has there been any water intrusion, roof leaks, window leaks, plumbing leaks? Are there any water stains anywhere? What type of HVAC system do you use? Where is it located? It was building practices to put HVAC systems in the attic, and that's the stupidest thing you can do. Not only do the pans often leak, but the condensation between the different temperatures, winter and summer, when you've got an HVAC system that both cools and heats, causes a lot of condensation in the duct system. And then if it's forced air HVAC, what kind of ducting material do they use? When were the ducts last cleaned? A lot of these flexible ducting materials grow mold really easily. Some of the newer ones have a little bit better lining on them, but there are also building practices where they just, as a return conduit, will just use the 4x4 struts and the backside of the drywall, as the vent, to return. And those materials with changes in humidity and temperature will just grow mold very rapidly. Then you can ask them, well, does food mold quickly in the kitchen if you leave it out on the, if you leave fruit in a bowl, how fast does it mold? Do cardboard boxes mold anywhere in your house? Do any of your closets get musty? Do you see any mold on the shoes in the bottom? Are there any smells anywhere? And then do you feel better after you've been out of the house, away on vacation for a couple of weeks and then come home? or when you're out of the house for long periods of time and you come back, do you smell something initially? And then I ask them about travel exposure and exposure to algae. I had one patient who's doing really well and her house had been cleaned, and she crashed on me one summer. And it turned out we just asked over and over and over again and went over. And it turned out she'd gone to the Chesapeake and she'd gone diving and swimming off of her friend's sailboat into a whole huge mass of wisteria bloom. So
Oh my
just
gosh.
that one exposure to the wisteria in the Chesapeake crashed her. So, you have to ask about those kinds of things, and exposure to algae, exposure to, toxic algae blooms. And then, if their infections are really active, you got to ask all about that too. So that's the way I start. And, I take a really good history. And then I sort of try to lead them to where they can think about looking for things. And then I like to do a sort of an ERMI type of test. And I like to have them look for both mycotoxin as well, PCR for mold as well as for bacteria. And then I also like the EMA from the real time, because they look not only at the PCR of the genetic material of the mold, but they also look for the toxins. But that can miss stuff. It depends upon where you sample. But it might be a good, sort of a screening tool. And then I do a urine test, right? So I do a provoked urine test, and I have them take glutathione for several days, and then I do a first morning urine. So if they've got mold toxins in their body and their screening dust test shows up, then we have to decide wherever they are in the country, who's going to be the best person to come in, what the possible problems are, and how they can investigate it. So that's how I go about approaching it. But I've had to, sorry, my little dog wants to come up. Yeah, this is Bigley. Say hi, everybody. Yeah.
Hello.
He wants me to play ball with him, but
Yeah.
can't do that right now.
Because I know, no, I was going to say, in terms of like one of the things that people ask when you mention the real time is there's several different urine tests. So is one like, do they have different information? Which one do you often use, or does it depend? And you mentioned doing a provocation, because that's another question that people always ask. Like, do you,
I like
do it glutathione or not?
I like to do a provocation if I can,
Okay.
because you want to start mobilizing toxin into the body so that your kidneys will filter it out and go into the urine. Remember, what you get in the urine is only a reflection of what the kidneys have filtered in the bloodstream. So you want to try to mobilize it. A lot of these toxins, they're intracellular, they're epigenetic modifiers. So they get packed away into the body, into cells, and they can be both fat and lipid soluble, so they can go into all tissues. And so you've got to start to mobilize them a little bit.
Okay.
And, you can, so I like to do that. I don't always, if someone's really, really sick, but I do. Sometimes you can mobilize too much, so you have to, be judicious about it. I've just always used real time. They were the first lab around. I mean, again, I've been treating mold illness since 2004.
Right.
So I got 18 years under my belt with this. So they were the first kid on the block, so to speak. So I've been with them. I've stayed with them. They've been consistently accurate in terms of when somebody's sick, their toxins are up. As they get better, their toxins go down. So it's been clinically relevant. They do use a type of ELISA. They use a semi-quantitative ELISA, because it's semi-quantitative because you do that because then you can compare relative levels of antigen in different samples, because the intensity of the signal is going to be different when you have different concentrations of the antigen in the specimen. Different labs use different methodology, and I don't know them well enough to go over them. Some people use Great Plains. They are like comparing apples to oranges. So they are complementary, but they don't substitute for one another, because they use very different methodologies. And I'm not saying they're not good, or they're not bad. I don't know, because I just don't have experience. Some people come to me already with Great Plains, and sometimes I'll repeat them and I say, listen, it's really nice, the more we have, the better, because some may pick up something that the other one doesn't. But I generally myself have always used real time.
Real time. And you said you use glutathione for how long, and what kind of dose do you use?
I usually use a teaspoon once a day for 5 days.
5 days,
sometimes a little bit more. Again, if you've got a really sensitive patient, you may not be able to use glutathione. So
Right,
you
yeah.
have to judge it based, it's not a cookie cutter approach. You have to treat based upon the patient in front of you in an individualized fashion.
Right. Okay. And what about, I know there's some blood tests too for mold. I don't know if they're new antibody tests, or do you know anything about some of
I,
the
I
other?
don't I don't use any of the antibody tests.
Okay.
I just never have. Um, if people have antibodies to Candida and things like that and molds, it means that they've had a leaky gut. The stuff's gotten through the leaky gut and it's gotten into the bloodstream, and their body's made
Right.
an antibody against it. So I guess it can be supportive. I just don't routinely do it. It's just not part of it. I don't feel I need to.
Right. Okay. But just kind of people, ask about how to test and how to look for it. And what about some other
No,
tests? We talked.
this is not a and this is not a disease that is primarily like an infection where you develop antibodies to clear it. Okay.
Okay.
The problem with
Well, that makes
biotoxin
sense.
illness patients is that they don't recognize these as foreign, so they don't even make antibodies to clear them. Right.
Oh,
That's
okay.
the whole genetic problem. Is that 25% of the population have a weakness in their ability to recognize these as foreign and then make antibodies to them. So it's really a epigenetic modification. It's a they upregulate systemic inflammation at the nuclear level, and they increase the production of inflammatory cytokines, and they do all kinds of damage. That's one thing they do. They are directly toxic. There's a whole lot of things that the mold toxins do, but most of the really sick biotoxin illness patients aren't going to have antibodies, so I don't
Ah,
bother checking them.
yeah, that makes a lot of sense. That's actually, because I know that, the percentage, not everybody reacts, but I didn't understand exactly why, like what did they manifest in terms of antibodies? So I think that's really helpful to know. What about, do you test for Marcons?
Oh
Because that
yeah,
was okay,
I do. I don't always do it right away
okay,
because if somebody's in mold and they're breathing in mold, you might get a false positive aspergillus fungal culture or something like that.
okay,
So, and then, when people are really sick, you can't go starting to treat Marcons. You're going to crash them.
right,
So I test everybody, but I generally wait a little bit to test and treat until people are in a mold-free environment and I know they're not breathing it in anymore. So
right,
that if I
okay,
do get a positive fungal culture, I know it's real. And also that the mold toxins, removal is well underway and I've got a little bit control of their systemic inflammation. And we've made some progress because you got to hit those Marcons and, you're going to just create a tremendous surge of inflammation again. So you've got to have somebody pretty well under control. And before you do that, you don't want to be hitting Marcons with somebody who's, got TGF beta 1 off the charts and MMP9 up high and tremendously out of control. You'll tank them and then they won't come back to you because you make them feel worse.
you're right, make them feel worse, right? Um, so in terms of treatment, what do you use first how do you begin a treatment for mold?
Well, you can't really sort of do things just one at a time, okay?
Okay.
The most important thing is to get them the heck out of the mold as you're, talking about what you need to do. They really need to be removed from ongoing toxic exposure, either at home, at work, at school, in their car. Then the next thing is to really get them to clean up their diet. I won't go dramatically into it, but of course, it's just going to be a clean, organic diet, no processed foods, et cetera, et cetera. No alcohol, cigarettes, no added sugar, et cetera, and grass-fed meats and all that kind of stuff. So, the basic diet that we tell everybody to do anyway, an anti-inflammatory type diet. And if, say, the place that they're going is a workplace, then they're going to need to go out on medical leave. If it's their church, they need to change churches. If it's the school, then they're going to have to keep the kid out of school until so the kid's not going to get better. And if a car is really moldy, it's best just to get another car. I'll be quite frank with you. Then the next thing you want to do is really reduce inflammatory cytokines. I use a lot of things to do that. I use Flex Now, a shea nut extract, which is marketed for joint pain, but it's really good at getting that acute inflammation that comes from an acute mold hit down. I, of course, love Curcumin Pure and Cytoquil from Research Nutritionals. I also use Zymogen's NRF2 activator. I use IMN Calm from Beyond Balance. I use ibuprofen sometimes in low doses, and there are others as well. Those are just sort of a smattering. You have to restore gastrointestinal vitality. I like to use the iron biome to help tighten up the leaky gut. You use aloe if they have a lot of gastritis. A tremendous number of my patients have come to me already diagnosed with esophageal eosinophilia in the esophagus, right? Or eosinophilic esophagitis or gastritis. They're just reacting to the mold toxins they're swallowing down. So you need to heal the gut. People's guts are a mess when they're swallowing mold toxins down. It's like putting, sparks on a silk scarf. It just puts holes in the gut. It's horrible. So you need to support the gut. So anti-inflammatory is supporting the gut. I use aloe, I use glutamine and judiciously, trace minerals, avoiding the foods that trigger them. Good probiotics. There's some probiotics that actually may bind some of the aflatoxins, like Lactobacillus plantarum or Lactobacillus rhamnosus is another really good one. That's just cultural LGG is Lactobacillus rhamnosus. And then they're protective foods, parsley, carrots, cruciferous vegetables, red fruits and vegetables that have lycopenes, and then cholagogues, things that help you make clean, new, fresh bile, taurine, phosphatidylserine. I love the Colinest from Nestman's that are sold by Marco Pharma. And then people may need help with digestive enzymes. They may need bile salts. They may need motility agents. Some people with who have problems with biological toxins, like mold toxins, are constipated. Some people have diarrhea all the time. The people who need help with motility, it's usually potassium and magnesium they need. Because we need to get the gut healed, because you need to use the gut. You need to use the gut to bind the toxins to get them out. So the gut has to be working. They have to give them some relief from the gut. So that's an incredible important thing. And then you need to add binders. Now this is all sort of done all together. It's not
That's
like,
what I was wondering, if you do the binder first. It sounds like, do you do the binder with the inflammatories?
If you do everything all together.
Okay.
And you pick what you feel you need for the patient, and you want to get them to clean up their diet, get out of the mold, reduce inflammation, fix their gut, start binding. Those are the most important things. So what do you really need? One of the easiest and one of the most broad acting is just plain old activated charcoal. It's hard for a lot of people to tolerate, and it doesn't get everything. But I use, Nature's Way activated charcoal. It costs $11 a bottle, and it's sold in most grocery stores. Toxie's Bind from Beyond Balance is good. The Systemic Formulas has got a bind that's good. Takasumi is good. Mycotoxin from Allergy Research Group is excellent for getting the trichothecines. I like the Metal Pull from Research Nutritionals, and then the new, the Metal Pull is now Toxin Pull, excuse me. It's an old habit. And then the new Mycopull. I also use a lot of GI Detox from Biobotanical Research, and I even use chlorella, especially in patients who are really sensitive, except you have to be careful because sometimes it can activate mast cell a little bit. And then sometimes microsilica, although that's usually better for getting aluminum out. And I generally will use more than one binder. I usually start with one and then get them going, and I often will use them in combination, especially if somebody's really got a high mycotoxin load. Then you have to always add fibrinolytic enzymes and some kind of enzyme support. If you don't add enzyme support, it's not going to work. Your treatment's not going to work. So you need either nattokinase, you need lumbar kinase. Baluch from Research Nutritionals is the best. It's the only one that really works. The other knockoff brands just don't work like the Canada RNA does. I've tried them over the years. I've been using fibrinolytics since 2005, and it just, the other brands of Baluch just don't work. Lumbar kinase. There are peptidases. There are a lot of interesting combinations of enzymes that can be helpful. Using glutathione and using other individualized supportive nutraceuticals can be very helpful, especially B vitamins, trace minerals, especially zinc, manganese, magnesium, mitochondrial resuscitation nutrients sometimes, but you can't expect a whole lot from your ATP fuel if somebody's up to their eyeballs in mold toxins. It just won't work, and it's wasting it. So, you can start with it, but because it'll help. But the mold toxins are mitochondrial poisons, and they just stop them dead in their tracks. So, you've got to be getting the mold toxins out of the patient's body. If you just think you're going to throw ATP fuel at them and then give them ATP 360 to make them make more mitochondria, it's not going to work unless you're actively getting the toxins out of the body. So you have to think about that. And then, I do use, you sent me some questions from one of the attendees already. I do use, sometimes I'll use essential oils, or people who are interested in using essential oils, I'll talk to them about what they can do to combat mold in the environment. Tea tree oil, oregano oil, thyme, cinnamon, clove. I like myself thieves oil. I think that's a great one. I clean with thieves oil cleaner.
Are you talking about like oral essential oils?
These are used, either evaporating in the air,
Okay.
or using as cleaning, not taking them internally or not putting them on the skin. Okay. Now, supportive oils that you could use, in carrier oils, or you could use, to smell, are things like lavender, help calm, peppermint can help the stomach, rosemary, lemon, all of those things can be supportive oils for symptoms. But somebody had a question about the essential oils, so I thought I'd add in what I've, had fun with in the past. I love the thieves oil for cleaning, and that really does kill mold. People also, one other thing, I just had the last patient this afternoon. The young fellow's trichothecenes were going up. Everything else is coming down, and they've really well fixed the house pretty well, and they're not sure about his school, but it doesn't seem to be a problem. And so finally, just at the very end of the appointment, mother says, well, we finally, I noticed that there's a funny smell in the washing machine. And I finally had my husband open the drain on the bottom, because it's one of these front loaders, and all this horrible gunks came out. And so, those front loaded washing machines always mold. They're just disgusting. So unless you are very careful about keeping them clean, and you're very careful about letting them dry completely between washes, you're going to have problems. He wants me to spell the thieves oil. It's just thieves oil. It's a mixture of several oils. Okay. You've got to also ask things like that, because people, this is a patient who's been with me for, a year and a half now. And finally she said, oh, by the way, at the end of the appointment, after we've already been discussing where could this trichothecenes be coming from, for 10 minutes in the history before I examined the child, and she tells me, oh, by the way, the washing machine's full of mold. So, you have to ask people, and that happens more than you can believe it. You believe it really does happen a lot. Duration of treatment with blue, you treat as long as the patient's in care, and as long as the mycotoxins also create hypercoagulability. So until the patient's really 100% well, there are no more mold toxins in their body, you really need to do that. The other thing I really like to do, besides using binders to get mold toxins out, is to sweat. A lot of people can't sweat. They're so devitalized that it would just like destroy them. It would just, they get really sick. So as people start to improve in their vitality, and you've given them a little more vitality, if they can sweat in the sauna, it's great. Start slowly, support them with B vitamins, trace minerals, electrolytes, fluids, glutathione. But if they can sweat out toxins, that's really good. So sweating and binding are the two best ways of removing mold toxins from their body. And then graded physical exercise as they're able to. You want them to start very, very slowly and advance only at a snail's pace, because if they go too quickly, they are going to overwhelm their body's ability to create mitochondrial energy, and they're going to hurt their muscles. They're going to go into anaerobic respiration in their muscles and hurt damaged tissue. So they have to be very, very slow about it. And initially, they just can't. Most people just can't.
Okay. I think you started to answer that, but how long is it common to treat people?
Well, there are a couple of variables there that you don't have any control over. Okay, so It depends upon how fast they clean up their environment. And
Okay.
I've had patient in treatment for 5 years before they finished cleaning the mold out of their house.
Oh, wow.
You know, I say, you could have saved yourself a whole lot of money if you put that money up front into your house rather than coming to see me. But if people really get their house cleaned up and they do it fast, and if they are compliant with their treatment regime, and it also depends upon how long their lifetime exposure is. If this is somebody who's only been exposed to mold for maybe a couple of years, it's going to be different than if somebody is 50 years old, they grew up in a moldy house, they went, lived in another moldy house, then they went to a moldy workplace. If they've got 30, 40 years of mold exposure, it's going to take longer. But in general, given all the positive factors in that they're compliant with all the things that I ask them to do, most people are feeling significantly better within 8 to 12 months.
Okay.
So, but it doesn't mean they're done.
Right. They start to feel better.
It means they really start to feel better. And it really depends upon, how long their exposure's been, what their other comorbid infections are, what their other medical problems are. If they have a hypercoagulable SNP and they're really hypercoagulable, then it may be harder for them. If they have a whole lot of tick-borne infections, if they got Borrelia, Babesia, and Bartonella, and Ehrlichia, it can be a whole lot harder. If they keep getting re-exposure,
right?
That was one problem my son had. He'd go away to college in the fall, and even though I'd written this whole huge letter to the college about it, the first year they put him in a basement dorm that had flooded, and they had to remove the carpet. Well, by October he'd crashed, right?
Right.
So the next year he goes and he lives in a fraternity house, and that was moldy. He crashed in October. The next year he went to live in a house in Lancaster, and it was moldy, and he crashed. So he's like, you just have to. You can't keep getting mold exposures. Now, what I like to teach my patients is once they're better and they come through that incredibly multiple chemical sensitive period, and then they start to improve, they learn to recognize when they've come into a moldy environment. So I teach them what to do to block that inflammatory response when they've come into mold, right? So I give them a protocol for a mold hit. We call it a mold hit protocol.
Mold hit, yeah.
And
what is that? What's the mold protocol?
Well, a mold hit protocol involves incredibly rapidly, going home, cleaning your nose, face, skin, shower, changing your clothes. Flex now immediately, and then either something like curcumin pure or an NRF2 activator, ibuprofen, and then keep those going for a couple of days, depending on how serious the hit was. And then using the ion biome to stop any damage to the gut, and then increasing fibrinolytic enzymes if they're on any, or starting them if they haven't been on them, and then making sure they take a binder for several days, and they usually use whatever combination worked best for them, and then they do that for 3 to 5 days until everything gets down and they calm down. It's hard on the body to go through that inflammatory cytokine surge of mold hits. So you really want to try to limit them. People get to understand, they walk into a store that's moldy, turn around, they can walk right back out. Or you're going to dinner with friends, you sit down, the restaurant's really moldy. You just can't stay. You have to say, I'm sorry, guys, this place is making me sick. I have to go. Let's see if we can find some other place, right? Don't say, suck it up and say, oh, well, I'm going to spend the night in this hotel because I don't want to make a fuss and ask for a cleaner room. Don't do that. It's asking for trouble. So that's how I try to educate my folks so that they can take care of themselves when they have that problem in the future, or take care of their children if they have that problem in the future.
Right. Okay. What about retesting? Like, when do you know to retest? Because I've seen some people who, and maybe this is very test specific, who seem like the levels go up before they go down. And is that?
Yeah, I usually test about every 3 months. And think about it, depending upon how much the patient has absorbed over their lifetime, because a lot of these patients can't get rid of them themselves anyway. They just don't. There's sort of a bell curve, right? And of how well they can get rid of toxins, how well they can't. So the people on 3/4 of the right side can make antibodies and clear these toxins. They'll get sick if they're in it all the time, but they can clear themselves and they can get better, without a whole lot of intervention. The quarter on that left side, they get really chronically ill and they can't clear them, right? So as you start to mobilize them, you'll see them come up, peak, and then go down like this. And sometimes you get a little bit of ups and downs. People have different rates of detoxification. Sometimes people have psychiatric blocks or psychological emotional blocks that trap toxins in the body, that once those get unwound, all of a sudden they'll download a whole lot. But what makes me worried is if I see a trend where, I've come up, I've seen the peak, and then I start coming down, if all of a sudden there's a consistent 2 or 3 upticks,
right,
then that's worrisome when everything else is going down. Like the child I saw today, everything was going down except the trichothecenes and the zearalenone. Well, the set point for the zearalenone is so new because they just started checking those at real time that I didn't have a second point for this particular patient. But the trichothecenes have been slowly climbing. And so, that's dangerous. Those are really bad toxins. When everything else is coming down, you got to think, well, okay, well, where's he getting that? Think about trichothecenes come from molds that are in constant moisture. Well, a washing machine's a good choice, right?
Mm-hmm. Yes, and I wouldn't have thought about it, but that makes sense.
Yeah, so you have to think, are they, or for instance, a child, the mold toxins come down, they come down really well. They're down in June, they come down in August, and then all of a sudden, boom, October, they're off the charts again.
Like school.
School. Yeah. Or somebody's been out of work, they go back to work and they don't feel well and the mold toxins go up, it's work, right? So it's helpful to follow. There are some times though where again, people will detox at different rates and different toxins tend to detox at different rates. And it depends upon, what binders you've used as to how well you may have gotten one out versus the other, and different people need different things. It's very individualistic. And so you have to sort of, sometimes you have to go back and retarget with different binders too.
Right. So there's no kind of like, usually the first 3 months it goes up and then it goes down. So it kind of depends on the person and the toxins then, kind of what pattern.
Yeah. But if I see that somebody's come up and gone down, then, and they've stayed down for a while, and then all of a sudden they pop up, then it's almost always another exposure of some kind.
All right, that makes sense. What about antifungals? Do you ever use antifungals?
I will use antifungals sometimes in the nasal sprays that I use for, treating Marcons if they have fungus. I don't routinely use systemic antifungals. I also check stool tests. So if people have different types of fungal growth and candidal growth in their stool, then I'll treat that appropriately. Okay. But I don't mold patients don't always have mold growing in their body, right? I just don't think that that's accurate. They can sometimes have mold in their sinuses, although I rarely get true aspergillus growth in the sinuses. People can grow aspergillus in the lung, but those are really sick people and they've got nasty coughs and they're ill, right? I don't think that these kind of molds colonize the gut. Yeah, we get different kinds of candida and other yeasts and things in the gut, but I don't routinely treat with systemic antifungals. I think that breeds resistant fungi.
Okay, even like herbal antifungals?
Well, I'm going to be using them anyway for their gut dysbiosis,
right.
Okay. So I'm going to be using things like oil of oregano and berberine and all kinds of other stuff for gut dysbiosis to try to get, I prefer using herbal remedies to get rid of dysbiotic organisms, but I will use allopathic antibiotics if I have to.
Right. Yeah. Can you explain that? I think there is confusion about the whole colonization. You breathe them in, so you're thinking it does not colonize. So really kind of is more systemic in terms of the mycotoxins?
The mycotoxins are toxins that are produced by molds,
right,
to control territory when they grow, right?
Right.
So they're a natural product of the organism as they grow and try to establish territory. Those toxins are damaging to us. It's the toxins that are causing the damage, not the actual growth of the organism. But people can get colonization of the molds growing in mucous membranes. Okay. I don't see it that often. It can happen in the sinuses. It can happen in the lungs, but again, if somebody's got Aspergillus pneumonia, they're sick. They're really
Right.
sick. I don't think you routinely get, colonization of the gut. So the way I check for colonization is I do a Marcon's test, and the lab also holds it for a month and does a fungal culture.
Right. Yep.
So that's how I test for that. And I, do good deep nasal, culture. I obtain good deep nasal culture, so I know I'm getting a good specimen. So I trust that lab to do that. But I
Okay.
don't think that people are, growing aspergillus in their tissues and things like that. It's the effects of the actual mycotoxin and the inflammagens of the particulates that create inflammation in the body. That's what's
Right.
causing pathophysiology.
Okay. But the mycotoxins themselves are systemic.
Yeah, they're all throughout the body,
Right.
but
Okay.
mycotoxins are not spores that cause growth.
Right. Okay. Yes, that makes sense. Okay. So when you're doing the binder, you're kind of trying to bring them out of the tissues into the gut to get
Yes,
rid of them.
it's a wicking action. You try to pull, so you get them out of the gut, and then the liver's always trying to get rid of them. But the problem is we sort of recycle them back into the body unless you've got a bile sequestrant to bind the bile and take it out through the gut. So you sort of are wicking it out by pulling it out of the gut by binding the bile salts. So the body's got to make fresh bile. So you've got to make sure it's got enough taurine, enough phospholipids. Sometimes, as I said, cholagogues can help in order to encourage good bile formation. And then it's sort of a slow wicking process out of the body. And you got to be
Okay.
careful. You need the anti-inflammatories on board because as you are mobilizing mold toxins, just like when you mobilize metal toxins, they
Right.
create havoc as they're in the bloodstream before the liver will take them out and put them in the bile and dump them in the small intestine. So they're transiting from the tissues to the blood to the liver. A lot of alarm bells go off, just like with heavy metal movement. So you have to have your anti-inflammatories and your fibrinolytic enzymes on board because mold toxins really stimulate a lot of hypercoagulability, just like moving heavy metals does.
Right. Okay. That makes sense. Now, do you ever use transfer factor, the Enviro? Just kind of
Yeah,
thinking about
I have used that, and sometimes people seem to like it right away, and sometimes people seem to like it later in treatment. But I
Okay.
have found that to be useful, yes.
Okay.
And hopefully it's helping their immune system to find more, of the toxins that are there. But I have found that useful.
Yeah, that's how I think about it too. But it sounds like, yeah, I've never used it right away. It feels like it's something that kind of, in terms of treatment, helps. In terms of time, I just wanted to say if there's anything else, any more pearls of wisdom, anything else you can think of, and then we can kind of go for questions.
Yeah, you really need to get people out of the mold. If they're not willing to do what it takes to remediate their homes or leave their homes or leave their work or take the kid out of school, you're really not going to be able to help them much. And you have to really be firm about it, but offer that helping hand so that they have someone to touch base with about it. And it can be really hard to find homes, if they're trying to look for a home, and you got to help teach them what to look for when they're going into a house and things like that. So as long as they know that they've got your support, it's good. But again, some people are in denial. Again, I've had patients that have been with me for years that I'm still trying to get them to finish cleaning up their friggin' houses because they just aren't getting to it, and I don't know quite where the block is with that. But the faster they can get out of mold, the better. So you got to reduce inflammation. You've got to
Right.
buffer hypercoagulability. You have to detoxify them aggressively. You've got to support them metabolically and nutritionally. And you've got to treat other infections. You can't just say, well, I'm going to handle the mold and then I'm going to treat the Lyme and the Bartonella, or I'm going to treat the Lyme and the Bartonella and then I'm going to handle the mold.
Right.
The latter is absolutely asinine. Don't ever do that. Don't ever say, I'm going to treat the infections first and then go for the mold, because they won't get better and you're harming them body. It's really not wise to do that. That makes me really irritated when I hear people.
Because you're just increasing the inflammation, or you're just increasing inflammation and the toxins.
Oh yeah, and then they can't resolve it because you're creating a die-off Herxheimer. A lot of these people who are biotoxin illness, they also have a problem with the toxins that come from Babesia die-off and Bartonella die-off and Lyme die-off, right? So you're
Right.
just loading them up. So you've got to do it all together. But you can't just say, well, I'm just going to treat the mold and I'm not going to worry about the infections until the mold's done. No, 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 no. The infections will run rampant as long as people are in mold. You
Right.
need to kind of keep a lid on them. So you've got to gently go and try to keep a lid on them as you're getting people out of mold, as you're detoxifying them, as you're getting them better. And then as their mold burden, the toxin burden gets down and they're feeling better, then you can be more aggressive with the antimicrobials. But you should always have something on board to keep the infections from going rampant and going
Okay.
roughshod. One of the hardest things is when people have babesia, because often after mold hits, people's babesia will flare really badly. And you really do have to kind of try to smack that one down. But you can't be really, really super aggressive with Bartonella until you've really gotten a handle on the mold, because so many of the neuropsychiatric symptoms are the same, and you will flare somebody so badly they're not going to be able to take the anxiety, or they're not going to be able to take the obsessiveness, or the kids will start stimming so badly and ticking so badly that they're not going to be able to tolerate it at all.
Right. Yeah, because I said I treat patients with autism with all of these infections and mold, and it's a lot.
It is a
You know,
lot. Yes.
you know,
Yeah. Yeah.
it's
So I
not
guess
easy
that's,
thing.
it's really a holistic approach to people. And everybody's different. Everybody's treatment protocol is going to be different. If you have the ability to do kinesiology testing, that can really help. But you should always have the arms of, those pillars of support there. You need to have their good diet. You need to have their clean environment. You need to have anti-inflammatories. You need to have any hypocoagulation. You need to, fibrinolytics or enzymes of all kinds. You need the nutritional support. You need the binding. So you need to have all of it all at the same time, and antimicrobials, but at varying levels. And then
Right.
as you peel away that onion of the illness, then you're going to be able to, go deeper and go more aggressive with their underlying infections. And then that's why it takes people a while. People are feeling a lot better in 8 to 12 months, but when you really get them cleaned up from the mold toxins, that's when you can really go after their infections. And so that takes a little bit more time, especially if people have been sick for decades, which a lot of my patients have been.
Right. Yeah, that makes that is a lot of our complicated patients. So I don't know if you can see any of the questions. I think there's some questions in the Q&A box too.
Yeah, I can see in the chat. So I'll go back to, let's see.
Or if you can see, there's a few in the Q&A also.
Oh, do you want me to go there first?
Sure.
Oh, the dosing for glutathione, I answered that.
Yep.
Usually it's a teaspoon once a day, sometimes a teaspoon twice a day. In kids, you'd go to a half.
Okay.
Unfortunately,
Like
mold
a
is almost
450
everywhere.
milligrams. Our Trifortify is 450 milligrams per teaspoon. Does that sound?
Yeah.
Yep. Okay. About the right dose.
Yeah, I love the Trifortify. The watermelon's good. It's either the watermelon or the orange. That's they're great. They're very effective. I know there are a lot of other companies that have glutathiones, but I found that the Trifortify has been the best I've ever used. Over the last 18 years. Actually, it'd be 19 years this in a couple of months that I've been doing this work. The cat says, unfortunately, mold is almost everywhere. Doctors, office stores, almost all schools. How do you cope after treatment with this issue? You do the best you can to avoid it, and then try to avoid taking a job in a place that's moldy, and teaching the patient how to handle it. But they really can't go back into a moldy environment or they're going to get sick again. Limbic system training, I don't have a lot of experience with it. I know Scott Forsgren has done that. I've talked to him about that, and I think it can be very helpful. But I think it would be something to use after someone's pretty well cleaned up. CPAP machines. Oh, that's a great one. Yeah.
That's interesting. That's a good thought.
Yeah, that's really good, Alan. I like that. Yeah, you can get really sick, and pulmonary aspergillosis is horrible. That's really sick. Yeah, the CPAP machine is another good source. Thank you for reminding me. That's a great answer. Great question or comment. How do you wash mold exposed clothes? Well, it depends upon what the toxins are. Borax will kill the Aspergillus penicilliums and most of the toxins, but it takes bleach to kill trichothecenes. So some people will use EC3, which is another killer. EC3, let me see if I can get a link for you for EC3. Mold cleaner. It's a laundry additive. That supposedly kills everything. They sell it at Amazon. They sell it all over the place. Let me just get microbial balance health products. I'll just show you that. So EC, like capital E, capital C3, health products. This is, I don't know whether this is a site that sells it or whatnot, but I'm just going to so you can see the actual name of it. That works too. A lot of people use those things. But if you want to kill everything, you need, one wash with borax and one wash with bleach. And then ultraviolet light kills trichothecenes as well. If clothes can't be washed, then they can be dry cleaned. Draperies can be dry cleaned. But things like mattresses and pillows, like down pillows, you should just throw them away. Most porous stuff that can't be washed, you need to chuck it. If you have papers that are obviously moldy or smell of mold, and you need to keep them, then put them in plastic, container, in plastic sleeves. If you really need stuff and, books that are important or family photographs are important, until you can get to them, put them away in sealed plastic bins. Walmart sells some really nice plastic bins that have pretty good seals on the top. Get everything out of cardboard. I don't know citrusate. That's not, I'm not familiar with.
Okay.
Then Robert asked, is TGF-beta1 out of all the inflammatory markers the best for evaluating how well the treatment is going? Is losartan the best way to treat? And what dosage do you use? I use all of the inflammatory markers. I usually look, for TGF-beta1, C3A, C4A, MMP9 are the four main ones. TGF-beta1 is really high in, stop that, please. I'm not playing ball right now. He's laying on his back with his ball and he wants me to throw his ball. TGF-beta1 will go, way up as soon as you've had a mold hit. So yes, it's a really good one for following. But the MMP9 you also have to follow. C4A is more consistent with mold, inflammation and infection. C3A is more associated with autoimmunity, but they can cross over, so it's not specific. I don't use losartan. I don't use any of those. I tried, that whole route years ago, and I just found that, it didn't work for me. So I don't use that class of drugs in my patient population.
Okay. I think that's all. I don't know if there's any more questions in the chat.
Got quite a few questions. I'll post them in chat for you.
Okay.
Yeah, I've got, I'll go back up to questions here. Let me see. Okay, I'm going back up to like 6:15 and I'll go down. You wanted to hear about the intersection of mold and parasites. Well, parasites are sort of the superficial layer in the gut that controls, all of the dysbiosis. So you really need to address parasites. And, this talk was primarily about mold. Sorry about my dog squeaking. He's being irritated. But yeah, you're going to have to deal with all of that when you're dealing with the gut dysbiosis, and you always have to deal with parasites. And yes, moldy patients tend to be a whole lot more full of parasites than people who don't have problems with mold. Okay. We did the glutathione before. That's okay. The people that don't make antibodies are non-secretors. The people that don't make the antibodies are the people that have the, HLA, the DRB1, the DQB1, the DRB3 through 5 that are, associated with the mycotoxin illness as, a la Richie Shoemaker's HLA protocol. I've drawn that on every patient that I've seen just about since the beginning of my practice. So the vast majority, if not all of my patients, are ones that fall into either mold, Lyme, or multi-susceptible categories, or else they wouldn't be sick enough to come to me. So, I know people like Neil Nathan says, well, don't bother doing that because then people get, this label. But I find it helpful because it I always tell people, listen, this is your hard drive, but we can, change and alter how your hard drive's read by the software that you apply to it. So, this is not a death sentence. It doesn't mean that you're always going to have problems, because I have people who are, homozygous for some of the dreaded gene types who are really easy to treat, and other people, with the dreaded gene types who are really difficult to treat. So it really depends upon your lifetime exposures and the other factors and variables. But yeah, that's what that means. The joint supplement is Flex Now, FLEXNOW. Yes, it's Flex Now, SM, spelled it correctly. You have to ask Debbie about the recording. Thank you. I know Baluch is awesome. The dose of Baluch, well, generally you just go 1 twice a day when you're starting with somebody. But sometimes I'll start with nattokinase. Remember, nattokinase works more at the level of the endothelium, intravascularly. If somebody's really boggy in their tissues and they're sort of that leptin dominant, overweight, boggy person where you can't, feel their veins through their skin when you're trying to draw blood because there's so much tissue edema, those are the people that Baluch really helps. Nattokinase is also sometimes very, very helpful. Sometimes more helpful when there's a lot of vasculitis. There's a lot of Bartonella infection. There's a real problem with the endothelial lining in a lot of these patients. The Thieves, I did do that. Yeah, Young Living Essentials. You got to find somebody who's into that, the multi-level marketing. I don't really have a cheat sheet. I do have presentations I've done. One presentation I did about mold toxins, glutathione, and heavy metals is on Scott Forsgren's site. It's Better Health Guy. I can't type. BetterHealthGuy.com/Corson. It's called Corson's Corner, and there's a lot of information in those PowerPoints. I think the mold toxin one I gave, mold glutathione and heavy metals, I did at the TFIM in 2019. You can scroll down and look at that. You get the PDF of the lecture.
Yeah.
That would be helpful.
I have a quick question about talking about resources. Like your questions that you asked about I wouldn't have known all those different specific questions. I don't know if you have that written or some kind of list too.
That's in the PowerPoint from 2019, TFIM 2019.
Okay,
that's on.
I think that's really helpful.
Scott's site. I know, because I've developed that just over years of having to figure it out with people, and thinking about it. And you got to learn about, in the 60s, sometimes they used soil drain pipes that were sort of like concrete with cardboard around them, like you see the cardboard around pilings, for support beams for porches and things. Well, they would use a concrete pipe with that around it. That degrades over time, and then their soil pipe is leaking. And then you've got to understand the different types of ducting that was used, and all the different kind of building. And OSB came in, OSB board. They do a metal frame, they do OSB board, then they put Tyvek on the outside. If the OSB board, which is pressed plywood, if that gets wet, while during construction, then that stuff molds to beat the band. So you've got a damp, moldy OSB board. They put Tyvek on the outside of it, it's sealed, and then they close the house up and put drywall on the inside. Well, hello, the whole house can be bad, right? And then you got to know about their stucco. There were early stucco from the 70s and 80s, leaked horribly, and it was stucco was a real problem. So, these are the things you just learn over time. But at least a lot of those questions are in that PowerPoint. Let's see. Do I use VIP? I don't always have to. I used to get MSH on everybody, and everybody's was 0. And, there wasn't a whole lot we could do about it in the beginning. And then when we started to use VIP, it helped a little bit, but it's kind of expensive. So some people it helps, and I just don't use a whole lot of it, because if people are feeling better, then why use something else that's really expensive? So again, you don't treat mold first, you treat everything all together, but you have to focus on the mold first, because you'll never get rid of the infections if you still have mold. And if you try to treat the infections without dealing with the mold, you won't be successful. So it's really important to get the mold toxins out of the body, get people in a clean environment, get their diet cleaned up, et cetera, and do all those things we talked about for the last hour or so. And, you have to use antimicrobials, but you can't go just in with a sledgehammer or a steamroller with antimicrobials because it won't work. You got to wait till they're feeling a little better, then you can ramp up the intensity of your antimicrobials. Okay, the best way. Yeah, I agree. Diet's really important to help reduce inflammation. The body, some people can clear mold toxins by themselves. 75% of the population will actually generate antibodies, develop antigen antibody complexes, and pee them out and poop them out and get rid of them, right? And sweat them out. So yes, 75% of the population can do that. But the people that are sick, they're coming to see us, generally aren't those people. Do I see new onset Crohn's ulcerative colitis? I can see a lot of people who have ulcerative colitis and Crohn's type symptoms, and they're almost always in mold. I don't know what came first, the chicken or the egg, but I suspect that the vast majority of those inflammatory bowel diseases are due to a combination of toxins and infections. Don't you remember Martin Freed years and years ago, the pediatric gastroenterologist from New Jersey? He biopsied Babesias, Borrelias, and Bartonellas out of kids' intestinal tracts until the New Jersey, medical board came after him and he had to stop doing that. But he was publishing about it, 20 years ago. So I think that there's probably a combination of factors that can create those inflammatory bowel diseases. I see a lot of people with Bartonella problems that have those, as well as mold. A lot of times, like the eosinophilic esophagitis and the gastritis, the reflux, all those upper GI symptoms just go away when they're not in mold anymore. Yeah, so again, the mold toxins can be associated with those inflammatory conditions. I don't usually use any kind of testing to test the fibrinolysis, except, I have a huge hypercoagulation panel that I run. And one of the more recent lectures that's up on Scott's site is called What's the Fuss About Fibrin? And I did that for the 2021, I think, Forum for Integrative Medicine, or 2020 Forum for Integrative Medicine. Can't remember now. Either 2020 or 2021. And then I just did it again at ILADS, and I added a whole lot about the coronavirus and the hypercoagulability there. If anybody wants that PowerPoint, which is a little bit different than the one that's on Scott's site, I can send Debbie the link to a Dropbox folder which has it. But you can look at that presentation. It'll tell you all the things to follow for hypercoagulability. So I always do a whole big panel on my patients, and then I will follow what's abnormal. If their fragment 1 and 2 is up, and their D-dimer's up, and their protein S is low, then I'll follow those things. And then, but I don't have a specific test. It's not like following a PT-PTT when somebody's on Coumadin. Okay, now I gotta get back up here. Boy, there are a lot of questions here. Okay, I'm back up to where I was at 6:47 here.
Yeah.
Okay. Argentine nasal spray can help, yes. I usually start with the ion biome nasal spray, just to try to break up stuff. And there's a new enzyme that I'm trying just recently. I learned about it at ILADS. It's from US Enzymes called SEAXYM, SEAXYM, from US Enzymes, and Master Supplements sells them, partnered with this company, and they seem to really help, break up the junk in the mucosa. I can use Argentine. I'll use all the different kinds of Marcon sprays, Beg sprays, any different combination, and some of the just, antifungal sprays. So I use all kinds of things. We talked about the colonization issue. Cola by Standard Process, it can be great. There are lots of different bowel salts. Standard Process is a good company. A lot of chiropractors use Standard Process. You treat both together. You don't treat mold first, but you treat both together, but you focus primarily and more aggressively on the mold issues first. And then you can shift and be more aggressive with the infectious stuff. But you don't want to just let the infections run wild, because they'll continue to do that while you're trying to detoxify somebody from the mold. So this is Joan. I'm looking at Jones here. Yeah, that's a real problem. The HVAC systems often will be pulling air from an area that's contaminated, either in the basement or somewhere, and creating damage throughout the entire house. So any central HVAC system that has forced air, you really have to examine that. I have people sometimes take dust from inside the ducting. You can cut a piece of your filter. You could take dust from your vacuum cleaner, but often houses are really systemically problematic because of HVAC systems that are contaminated. The numbness in the feet in Lyme patients, a huge amount of that is mold, because it causes a lot of peripheral neuropathy, but it can also be Bartonella. Bartonella causes a lot of peripheral neuropathy because it damages the small blood vessels. Yeah, again, you need to really, clear and detox. As I said, everybody's organ and drainage medicines has to be individualized, and you really need to clean them up, and you need to, because you're simultaneously doing everything. You're helping to get rid of heavy metal toxins, glyphosate, environmental toxins of all kinds by getting their diet cleaner and whatnot. And you got to be really careful if people have a mouthful of metal amalgams, because you have to be careful about not pulling so much that you start pulling out of the mouth itself. And you have to, at some point when they're feeling better, you have to start talking about biological dentist time. Yeah, okay, I gotta go back here. Yeah, we got that one, that one. Yeah, EC3 is great, isn't it? Yeah. The connection between mycotoxin illness and mast cell activation. I've never seen somebody with mast cell that isn't a mold patient. Unless they're, I guess I don't see anybody who has like a true genetic mast cell problem. What the literature, talked about. So every single person I see that has mast cell activation of any kind is a biotoxin illness patient from mold. How much mold illness interplay with parasitic? Well, we talked about that. Yeah. You've got to deal with all the metals. Metals like to hang on to fungus. Candida will hold on to mercury. So if you've got somebody who's got chronic candida, you've got to think, my gosh, they've got mercury poisoning, because the candida cell can hang on to something like 15 times the mercury that our cells can without being damaged. So often people will have a candida dysbiosis, or they'll have, candida in the mouth, or candida in their groin and things like that. And you can't get rid of it, but it's because they're metal toxic. And then you give them something to kill the candida, and then what happens is they have a horrible Hirschstarm. It's not a candida die off. It's because you're releasing mercury and making them toxic from their heavy metals. I learned that years and years ago from Gary Klepper. A simple and broad spectrum binder. There is no real simple and broad spectrum. The simplest really is, and easiest to start with some people, is just a small amount of activated charcoal. But now that Research Nutritionals has these very interesting combos, it might be good to start with one of those too. But nothing beats good old-fashioned activated charcoal. I've used it for years and years and years. Now often I'm using it in combination with other things. When somebody needs herbs to help with the liver, that's the systemic formulas bind, B-I-N-D. The Toxis bind from Beyond Balance also has humic acid, a fulmic acid source, and other things in it. I do like the two that the Dennis has put out in Research Nutritional. So really, Debbie has helped to formulate. Sorry, they are helpful. But I also really like the GI Detox from Biobotanical Research, and often I'm using it in combination. For instance, I'll have a kid on one GI detox and one toxin pull at bedtime, or one mycopull and one microchitosan, or one mycopull and an activated charcoal. Again, microchitosan is really, really good for getting the triglycerides. Now, years and years ago, of course, I started with cholestyramine, like we all did, way back in 04, 05. And it was just so hard for people to tolerate, and it created a lot of problems. But there are the rare patient that does really well with cholestyramine, but I use it very small. It's not even in my presentation. Let's see. Yeah, I'll give Debbie the link to the ILADS presentation. Yeah, Seaxym. No, SEAXYM, not Z. SEAXYM from US Enzymes, and I know the Master Supplements has those. Oh, there's no specialty enzyme company. There's all kinds of different enzymes that you can use in combinations. I love the Marcozymes from Marco Pharma. It's got bromelain and papain and all kinds of enzymes in it, which work really well. I use Claire Labs Interface. I use Interface Plus sometimes. I'll use all kinds of different serapeptidases. I recently started using one called Fibrenza, Fribenza, which is all kinds of enzymes all together. So all kinds of different enzymes. But, I wouldn't be able to have the success I have with treating my patients if I didn't use all kinds of different enzymes. So don't ever, neglect that in your practices. Neuropathy besides rifampin, is there any herb you have success with? Neuropathies can be very difficult because if the nerves are damaged, it can be hard for them, especially if there's fibrosis around the vasculature to the nerve, it can be very difficult. But the fibrinolytic enzymes help, and herbs to help with vascular healing. There are lots of different combos, but Aeschylus helps to dilate the arterioles, the small blood vessels. Nessman has something called Aeschylus. Aeschylus is horse chestnut. Danshen is helpful. Danshen, I use a lot of Supreme Nutrition products, Supreme Nutrition products, and their Danshen is very healing. There's lots of different healing herbs. I'm sort of blanking right now because I'm getting tired. Yes, those are very good, the things that Joan just mentioned. There, so it looks like I've gone through everything.
There was a question about how you treat POTS.
Oh, wait a minute, there's one more question in the pot, and there's one more question in there. Once one has cleared up toxins in Lyme, can the food sensitivities diminish? Oh, most definitely. They really do. I mean, you have to keep away from the patient the things that are really bad, that really floor them. But yes, once you heal their gut and their immunoglobulins fade away, then yeah, they can go back to eating all kinds of foods. Now, I never let them go back to eating gluten because gluten is just so incredibly toxic. But, certainly they can go back to foods, that they couldn't tolerate before, and they can widen their diet, but, don't push it. You got to really heal their gut first. And then what was your question? I'm sorry.
Oh, the question was about how you treat POTS symptoms.
Well, I haven't seen a POTS patient that wasn't a mold patient.
Right.
So, you're not good. The first thing to do again is to get them the HELL out of the mold, right?
Yeah.
And start detoxifying the mold. But you use all the same things that everybody else uses for POTS. You use salt. Sometimes they need the mineralocorticoids. I don't use a lot of the allopathic drugs that you see some of the doctors using that treat POTS. They specialize in POTS and they don't even think about mold. It just cracks me up. But so most of my POTS patients get better with getting them out of mold, detoxifying them, hydrating them, and giving them electrolytes and salt, things like that.
Okay. Well, I think, as I said, if there's any more questions, I can get them to you. I said we can kind of get any more. As I said, we've already kind of gone over time, but
yeah, I'm sorry everyone for the slow start. I just had not had that kind of problem, and I had deleted Google Chrome off my computer because Google is so invasive, and I do a lot of things in my human rights work with which I don't want people in my computer, about forced organ harvesting in China. So I don't use anything connected to Google. So I had to download Google Chrome in order to have the Zoom work correctly.
Right. Well, I mean, thank you for, joining me today. That was really very informative and really helpful. I was taking some notes, so I appreciate that. And I'm sure everyone appreciates you taking the time and educating us. So that's a long history of treating mold. So that's helpful, very helpful.
All right. Well, it's wonderful. And I'm sorry I didn't get to see everybody. I usually like to see everybody. It's hard when you can't interact. It's time to
Right, I
end all
know.
of the line nonsense, isn't it? It's time for
Yeah,
us all to get together again, in the same room and have the energy together, which is so wonderful. I miss that tremendously.
yeah,
So,
I very much agree. I miss it also.
all right, guys. Thanks for putting up with the little guy. He says goodnight too. Say
Okay.
goodbye.
Bye. Thank you.
Okay. Bye bye, everybody.
Bye.